So, welcome back. My name is Tara Galliano, and I'm a certified sex therapist and owner of Boulder Sex Therapy. And I'm so glad that you'll be joining me again as we dive deeper into how cancer and cancer treatment can affect your sexuality. So, I want to invite you to ask your questions in the chat and ask them as they come up for you. I'll be answering the questions in about an hour and a half after my presentation has begun. So know that I will get to all of your questions, and I look forward to answering as many of them as I can. And also know that you will be sent a recording of this talk tomorrow. And in addition, you'll be sent the previous week's talk as well. So both of those will be sent to you via email, and I'm sure you will appreciate them and that you can review them at your leisure and that you have access to them at any time. So beginning today, I wanted to provide a review of some key points from our last class. So sexuality, what it is and what it's not. So when I speak about sex, I'm actually speaking about the act, which is the behavior. And sexuality is something quite different in that it is an intimate part of who you are as a person. It's how you express yourself sexually, how you see, feel, think about yourself as a sexual being, and is expressed in your life through your actions and also through your relationships. And as mentioned above, there's many ways to express your sexuality, and it's not limited to intercourse and certainly not penile vaginal intercourse, that it is much more expansive than that. It is holding hands and hugging, kissing, flirtatious looks, suggestive glances, romantic gestures are all ways that a person can express themselves sexually. It's also in the way a person dresses, in the way that they move, and really just how they are. So often, how we show up sexually is informed and shaped by many different factors, including, but not limited to, our age, our gender, the relationship status that we currently hold, socioeconomic status, our upbringings, the emotions that we're experiencing in the moment, religious beliefs, cultural ideas, and ideologies. So a lot of factors influence us and how we show up sexually, including our overall health, which specifically we'll be looking at today. And sexuality is not our gender, nor is it our orientation. So gender identity is how a person identifies themselves, how they perceive themselves, and how they refer to themselves. And it's not necessarily determined by biology or how you were born. And sexual orientation describes who you're attracted to. And that can be emotionally, sexually, romantically, and that these tend to describe or characterize an enduring pattern. Another point of review is sexuality and cancer. So sex and sexuality are important for all people, and some of the benefits of sexuality include lowering your blood pressure, better immunity and immune system functioning, better heart health, possibly including lower risk for heart disease, improved self-esteem, decrease in depression and anxiety, and increase in sexual desire, or as some people say, libido. It's also immediate and natural pain relief. And it also provides better sleep. And when one is struggling with cancer or the treatment of cancer, it may impact your sex organs, your sexual desire, or your libido. It may also impact your sexual functioning, your body image, and your overall well-being. Sexual problems can develop because of physical or psychological side effects of cancer and cancer treatment. Surgeries may impact a person's sexuality, their sexual desire, and sexual functioning. Treatment can also affect how certain body parts function. It can change your hormone level and or cause nerve damage that can cause changes in a person's sexual functioning. And different treatments have different side effects, such as fatigue, nausea, pain, skin irritations, or other changes in one's appearance that may impact one's self-esteem and their sexuality. And so it's important for you to bring up your concerns about your diagnosis and treatment on your sexual functioning and sexuality. Unfortunately, for many reasons, healthcare providers don't always ask about your sexuality during your visits. And because of this, you may not get the information that you desire, you may not get the support that you need, or you may not get access to the resources to help you deal with your sexual problems, let alone your feelings about these concerns as they arise. And that is why I am doing this presentation, as I specialize in the area of sex and sexuality as a certified sex therapist. And particularly, I'll help you explore the feelings that arise from these issues of sexual functioning. So where I wanted to begin today, and this was mentioned briefly last time in the last talk, was about early penile rehabilitation after surgery. So I want to speak about some of the common sexual problems for men with cancer. So the recovery time for erections after surgery can be up to 2 years. And that's a really critical time period. If a man does not have an erection during this time period, the tissues in his penis actually may weaken. And so it's a critical time to have erections. And once this happens, he will not be able to get erections naturally. So in that 2-year period, if he does not have an erection, it will become more difficult to have an erection naturally. So some experts and doctors recommend different methods to promote erection, starting within weeks or months after surgery to help men recover sexual functioning. And you may hear this called penile rehabilitation or erectile rehabilitation. And that this has 2 parts. So the first part is to make sure you're getting regular erections that are hard enough for penetration. And it's best if you can have erections 2 to 3 times a week in this 2-year window, because this will help keep the tissue in your penis healthy. And then the second part of the penile rehabilitation is to use a low dose pill to help the blood flow around the nerves and help the nerves heal. And so the pill is a medicine to help produce erections, such as Viagra, Cialis, and those are typically used in combination with other therapies or devices. And since the drugs might not produce an erection because they need the nerves responsible for erections to be healthy, sometimes penile injections or vacuum devices might be offered. So I'll say a little bit more about that in a moment. So erectile dysfunction is one of the most common problems in cancer treatment. And the success rate of treatment to help with erectile dysfunction can vary greatly. And that oftentimes you may need to try a few to find the one that works best for you. And even if you're using the medicine, you might find that Viagra doesn't work as well as Cialis, or that Cialis has different side effects that are better than the Viagra. So in many cases, sexual counseling, such as with a sex therapist, can help you, and if you have a partner, the two of you to discuss the options and plan for how to make the new treatment a comfortable part of your sex life. So it's really this opportunity to learn new strategies and skills to increase the intimacy in your life. And I think that that's really important because oftentimes we have this idea that sex is organic or sex is natural and that it should just come to us. And when it doesn't, who do we turn to? And we might have some shame or some guilt about not having the information. And that can be painful. So having a trusted expert who you can confide in and receive this information with, I guess, with dignity and with care is really important. And so I want to come back to this idea that sometimes penile rehabilitation is an option. And again, this involves the use of erectile dysfunction medications along with other therapies as mentioned above. So let's see. Most drugs for erectile difficulties come in the form of a pill. And all of these drugs can help a man get and keep an erection by causing more blood to flow into the shaft of the penis. And if you're having trouble with erections, these pills are often the first type of treatment recommended. I mean, and they're ubiquitous. You can even see the television commercials now promoting them. And so it's not just men who have had cancer or experiencing cancer treatment who are working with these drugs. However, certain operations can affect the nerves that help cause erections. And these pills work with the nerves responsible for erections. And even with nerve-sparing surgery, which is saving the nerves responsible for erections that run close to the rectum and along the prostate, the nerves still might be damaged and need time to heal, which, as mentioned a moment ago, it takes up to sometimes 2 years. And many men may find the pills don't work well during the first few months after surgery. And that can be really discouraging. But know that those same medications might be more helpful as time goes by. So 18 to 24 months after surgery, the pills may be helpful in getting a firmer erection. And I think that's important to know. So initially, in the first few months after surgery, they may not be that helpful, but 1.5 to 2 years after surgery, the pills actually might be helpful in getting and sustaining an erection. And so it's really important that you communicate with your doctor all of the medicines that you're taking, even supplementation, and even over-the-counter medications and vitamins, because some of those can interact with the erectile dysfunction drugs or other treatments. And so make sure you understand all the side effects of the ED pills that you're prescribed, and that you know when to get help for any of those side effects. And that's important, that you're not in this alone and that you can ask your doctor for assistance. You can consult with them. You can speak openly about your concerns and about what it is that you're experiencing. And that nowadays, because it's easy to get access to medications over the internet, I just want to advise you that you can really benefit from taking the pills that are prescribed to you by your doctor and come from a legitimate pharmacy. That buying medications that claim to treat ED but don't need a prescription can lead you down a vast rabbit hole that may not be beneficial to you. There's a large counterfeit market for pills for ED, including natural supplementation that may not be effective for helping you with your erections. So really sticking to the ones that are prescribed for you, that you know help you and that your doctor has recommended. Another form of treatment are penile injections. And this is to inject the penis with a medicine that actually causes erections. And so it is a very thin needle used to put the drug into the shaft of the penis a few minutes before starting sexual activity. And I would say that a few minutes before starting sexual activity, that might include penetration, because certainly, and I think this is a really important piece, is that sexual activity does not require an erection. And I think that's a huge piece of the unlearning that I'll be speaking about later today. That oftentimes we have this concept of a linear progression of sex, and that it begins with stimulation, and then there's an erection, then there's penetration, and then there's orgasm. And certainly that statement is a complete sentence, but not always the one that is suitable for everybody. And so I want to speak more about that, about how there's a huge unlearning in this process of how to be sexual that may not include an erection or may not include penetration. But this particular treatment, a penile injection, is speaking about injecting this thin needle into the shaft of the penis a few minutes before sexual activity where you want to have an erection. And what happens is the combination of sexual excitement and the medicine injected helps to produce a firmer and longer lasting erection. So penile injections are the most reliable treatment for ED and work in many men who try them. And I have seen that again and again, that is really a powerful medicine for men to use when they're really wanting to have an erection. And so the first injection is usually done in the doctor's office, so you can learn how to do this yourself, where the doctor will teach you how to do the next ones at home. And often after the first one, men feel confident that they can do this themselves. And then although these injections are effective much of the time, you may feel nervous and anxious about having a penile injection and giving it to yourself. And that's normal, that it can be scary to engage in that activity. And that's why the first one is done in the doctor's office to build your confidence and your skill and know that you can do this for yourself. And I think that that's an important step forward. And then once having received it in this setting, knowing that you can replicate it again at home. So if penile injections are an option you're thinking about, be sure to know and understand both the short and long-term side effects. And usually your doctor can go over that with you as you're exploring your options. Another form of treatment is urethral pellets. And that is also referred to as MUSE, which is medicated urethral system for erection. An applicator is used to put a tiny pellet called a suppository, and this pellet has medicine, and you place that into the urethra, the opening at the tip of the penis. And as the pellet melts, the drug is absorbed through the lining of the urethra and enters into the spongy tissue of the penis. So you must urinate before putting in the pellet so that the urethral lining is moist. And then after the pellet is put in, the penis must be massaged to help absorb the medicine. This system, for a lot of men, is easier to tolerate and easier to apply than injections. However, it doesn't always work as well. So even though the application for many men is easier, it's not as an effective treatment as injections. Another popular treatment is vacuum erection devices. And this works well for many men. And vacuum erection devices is shortened to VED, right? So with a VED, the man places a plastic cylinder over the shaft of his penis and pumps out air to create a vacuum. And the vacuum surrounds the outside of the penis, and the suction draws blood into the shaft, filling up the spongy tissue. And when the penis is firm with an erection, the man takes the pump off and slips a stretchy band onto the base of his penis to help it stay erect. In layman's term, often people say it's a cock ring. And so really putting that band on the shaft of the penis to help keep the blood flow into the penis and keeping it erect. And the band can be left on the shaft of the penis for up to half an hour. And some men use the pump before starting sexual activity, but others find it works better after some foreplay to help with arousal and to help with desire. And therefore, maybe you have had or produced a partial erection. And it may take some time, like all of these treatments, it may take some time to learn how to use a VED and be comfortable with it. And that's really important, is your comfort level with any of these treatments, because if you're not comfortable with it, then you probably won't be comfortable with your partner. So it's important for you to have practice with any of these treatments by yourself so you feel confident. So this way you can begin to introduce it with a partner. And another form of treatment, which is more long-term, is a penile implant or prosthesis. And for men who've tried all of the treatments that I've just mentioned and haven't found one that works well for them, there is this, what I would say is a final option, and it's surgery to implant a prosthesis into the penis. And really it is a last resort, is what I would say for most men. And over the past several decades, many of these operations have worked well, and improvements have happened in terms of how this surgery is used and the success of the surgery. That the advances have come over the decades, and that it's a much better solution than it was in the past. And many men who've had implant surgery are pleased with the results. And there's different types of implants. There's not just one. And it really depends on many factors: your age, your body size, your penile size, your history, the needs that you have, the preferences of, your preferences for you. So an inflatable implant can have 2 or 3 pieces. So a 3-piece implant is an inflatable cylinder that's placed inside the shaft of the penis and a balloon-shaped reservoir. And the reservoir contains fluid that's tucked behind the groin muscle. And the fluid usually stays in the reservoir, leaving the cylinders in the penis empty. And then a pump is placed inside the loose skin of the scrotal sac. And all of the parts are connected with tubing. And then squeezing the pump moves the fluid from the reservoir into the cylinder, creating an erection. And when the pump is released, the fluid just goes back into the reservoir, emptying the penis. And then for a 2-piece inflatable implant, most of the fluid is in the back of the cylinders and the pump is put into the scrotum. And then a less common type of prosthesis is a semi-rigid or non-inflatable implant. And this uses semi-rigid rods that are implanted in the penis. And when a man wants an erection, he bends the rod up Otherwise, he can keep the rod bent down. And this is a simpler device than the inflatable implants of the 2 or 3 piece process. But it's less like a normal erection. Oftentimes it's smaller in size and usually not as enjoyable for the man or for the partners. But yet I know that many men who've had this are happy that they can have that pleasure. But again, there's so many advances in these surgeries at this time that it's always best to find out what is the latest therapy. In addition to those erectile treatments, there's hormonal imbalances that may be impacting one's ability to have an erection. So testosterone may need to be restored so you can have more desire and maybe have better erections. Having low testosterone can lead to low sexual desire and trouble with erections, regardless if you have a cancer diagnosis and are receiving cancer treatment, because it also leads to a loss of energy. So if you think you might have low testosterone, it's important to talk to your providers. Tests can be done easily to find out what your testosterone levels are, and you can discuss possible treatment options. However, testosterone's not for everyone, even if you have low testosterone levels. It's usually not given to men who have certain types of cancer. And then because we're in Boulder, right? Oftentimes there are alternative methods, acupuncture, herbal and dietary supplements that are sold over the counter. And that before you take those, it's really good to speak to your providers to make sure that these are going to be effective and safe for you. So in addition to erectile difficulties, men who are struggling with cancer and cancer treatment may also experience dry, painful, or weak orgasms. And so what that means is that semen is not produced from the penis when they ejaculate, because sometimes surgery has removed the seminal vesicles. And this is called a dry orgasm. Some men have dry orgasms even without surgery, and it is just a way that they experience pleasure, and that there's nothing wrong with this, and that it is, for many men, a normal experience. So while it can take a while to adjust to having dry orgasms rather, after surgery, there's no treatment. There's not, again, like I said, there's nothing wrong with this experience. It's just different. So men who have dry orgasms after cancer treatment also say they sometimes have reduced sensations. But that's not true of all men. So it's just a different experience, but the orgasm is still an experience of pleasure and an experience of release. It's just that there's no semen or fluid being emitted. Also, some men might notice that orgasms become weaker or are shorter duration than before. And that often happens with age, that the muscle contractions at climax are no longer as strong as they used to be. So this could be because of age. It could be because of cancer or cancer treatment, and that there's nothing wrong with this. It is just a different experience. Oftentimes, what men have reported is that more severe weakening of their orgasm goes along with erectile difficulties. So in these cases, treating the erectile difficulties actually may improve your ability to have orgasm. And that for a lot of men, that there's not an awareness that orgasms are possible without an erection or without a full erection. And that when they have an orgasm without an erection, they may be confused or they may not have known that that was possible. And yes, that is absolutely possible, that you can have a dry orgasm, that you can have an orgasm without an erection, that there's many ways to orgasm. And again, oftentimes we're thinking about sex in a very linear progression. And when we deviate from that, we think that something may be wrong. And in actuality, it's just something that is different. One side effect of surgery may be a painful orgasm, and that some medication may be needed to manage the pain. Or talking about this experience with the sex therapist might be helpful as well. So another side effect from specifically prostate surgery is that a man may experience penile shrinkage. So it's common after surgery, and the cause of the penile shrinkage might have to do with the surgery affecting the nerves that control erections. And so the blood flow changes. There may be scarring of the penile shaft, the tissues of the penis, and just changes in the penile tissue in general that result in loss of erection. And there's no known way to prevent or treat penile shrinkage at this time, although many people anecdotally report that penile rehabilitation can help decrease the shortening, and that actually the vacuum devices might be helpful. Okay, so now that I've covered some of the sexual problems related to cancer, I want to talk more about what are some of the solutions. And so, as a sex therapist and as a licensed professional counselor, what I can say is that communication is a critical piece of how you're connecting with your loved ones sexually, how you're connecting with yourself sexually, and that I want to begin with communication with your providers, because that is a really critical piece. As I mentioned earlier, oftentimes providers won't bring up issues about sex and sexuality. Sometimes it's because they don't have time, right? There's only so much time they're allotted with each patient, and they want to focus on the priorities. And often sexual functioning doesn't make the list. And that's mostly a timing thing and insurance billing item, not necessarily any malice of your doctor, but really they want to get to the important factors, and sexuality sometimes doesn't meet that list. Another factor just could be the provider's comfort level with speaking about sex and sexuality. So this is my area of expertise, but it's not everybody's. And so if the provider doesn't feel comfortable speaking about it, they may not bring it up. So that's where I want to encourage you to bring up the topic to the best of your ability so that you can have your questions answered by your provider. Because when they know that you're concerned, if they're not able to answer your questions, they'll give you the person who can. They will provide you with the resources. That is true of all of the doctors and the nurses that I've met. They want to be able to have your questions and concerns addressed, even though if they may not be able to do it themselves. So in addition to asking those questions, it's important to know when to ask the questions. So when is the time? And that's timing is really critical in so many things. And so when is the best time to talk with your doctor about possible side effects or long-term changes in your sexuality? And that's important at the beginning. So this way, when you're making treatment decisions, that you're fully informed about how your treatment will impact you sexually. And again, oftentimes we're thinking more about our own mortality. We're not thinking necessarily about our pleasure, but I encourage you that this is a quality of life issue, and that as you're embarking upon treatment, to ask the questions. And if it's not possible, or you didn't think about asking these kinds of questions before treatment, you can start to talk about them as soon as it comes up for you. So shortly after surgery or when treatment begins, it's never too late to bring up these subjects. That it's so important as they become important to you that you bring them up, that you are your advocate. And that if you can't be, that you have somebody who you know can be asking these questions for you. What I find is that oftentimes, even if we are ready, it's good to have a support person there who can understand the answers, who can document them, who can write them down. Because sometimes when we're in emotional state, we may be disassociated because we're flooded with emotions and we can't actually hear things in the way that they're said. So there's a disruption to our neocortex, and we're just not processing information in the way that we want to. So when you have a trusted loved one there who can hear the answers, it's always better. And if you could record the conversation and revisit it at a later date with your loved one, that's even better. So I want to encourage you to ask the best questions for you. So I want you to note some questions that are commonly asked to begin this conversation for you. So asking, will this treatment, whether it's surgery, radiation, chemotherapy, hormone therapy, will this treatment affect my sex life? And then if so, what can I expect? So being really clear and direct to the best of your ability. And then understanding, will the effects last a long time, a short time? Will they be permanent? What are the durations of these effects? And then next, asking, what can be done, if anything, about these effects? And then if you need help processing any of that information, is there a therapist or counselor that they can recommend? You also may want to ask, are there other treatments? Are there alternative methods that are just as effective but have different side effects that may not impact me sexually? And then another question you might want to consider is, do you have anything that I can read? Do you have any resources where I can find more information about this topic? So that's where I invite you to begin. And maybe you've already had surgery, have started treatment, and you didn't ask the questions before, and that's okay, because again, it's never too late to be informed. Or maybe you've spoken with someone and you heard about somebody else's experience with the same type of cancer that you have, or maybe you've been reading some things and now you have more questions. Or maybe you've been able to discuss things with your partner and you have a different perspective now and you have more questions. And that, whatever the reason is, if you are considering something, if you're curious about something, I encourage you to ask. That it's so important for you to be the best advocate for you and ask the questions. There are no wrong questions. And so you can say, I've been reading about this treatment and the side effects seem to indicate sexual difficulties. Can you explain that to me? Or what do you know about that? Or you might want to say, I know somebody who went through the same type of cancer and they had the same treatment, and now they're sharing with me problems that they had around sex. Do you know anything about that? Or do you know where I can find more information about that? Or you can even share your own experience, is that I'm having difficulties with some of the changes in my body, that I'm not able to function sexually like I was before. What can I do? So these are really good questions to begin to ask. And again, that there are no wrong questions. It's really just asking the questions that are important to you. Because when the questions are not asked, right, you don't get the information that you need, and knowledge is power. And so knowing answers to the questions you have and knowing what to expect can really alleviate a lot of anxiety, and it can help you and your partner begin to plan for what's ahead. That one of the biggest, I would say, biggest difficulties that I see for men and women with cancer and in cancer treatment is that they experience sexual problems that are caused or worsened by the anxiety that they're experiencing because they don't know. They don't know what to expect. They don't know what the future holds, that there's a lot of anxiety, and that can be alleviated through the process of speaking with a specialist in the area of sex and sexuality. And again, I want to, for those of you who have a partner, is that it's so good to be able to include your partner in the decision-making process, in the understanding of the procedures and the treatments that you're having. That as fears arise for you, that as questions emerge, that you can begin to share them freely with your partner, that you can have a dialogue that is intimate and vulnerable about your concerns. Okay, so I'm just looking at my notes, and okay, we've gone over the treatments, the prosthesis, the vacuum, testosterone therapy, dry orgasms, and okay, and so then this more important piece that I often see for cancer survivors is really feeling good about yourself and feeling good about sex. That this psychological and emotional component is often one that's overlooked. So, what I see is that for people who are in partnership, they sometimes can withdraw from their lover emotionally, that there's a difficulty in relating with each other. Sometimes the person in the relationship, that they don't know how to relate to the one with cancer, and that they're afraid to touch them because they're afraid to cause pain. So I think my biggest desire is to share that it's important not to give up on each other, that there's so much available to each other, that it'll take time and it'll take effort to relate to each other in a different way, but that sexual touching is always possible. So I want to share a little bit more about that. But I want to remind you right now that if you have any questions or if anything's coming up for you around this topic, that you can write them in the chat and then I'm happy to answer them. That your questions are really important to me and help guide this conversation. I want to make sure that you're getting what it is that you want out of this talk, and that, yeah, I love the engagement. So let's see. So what I wanted to speak about is this dynamic of the caregiver and the person with cancer. And that oftentimes in this emotional relationship, there's a dynamic where what I see is that the person with cancer is withdrawing emotionally from their lover or from their loved ones, or from their significant other, and the significant other does not know how to approach them and is waiting respectfully oftentimes for the direction from the other. And sometimes that doesn't come. And so then there's a chasm that's built between the two of them, which they don't know how to bridge. And that can be really painful. And so the caregiver feels like they're being respectful and waiting for the other, right, for the one with cancer, to give them a cue of when it's okay to be sexual or when it's okay to express love. And when they don't get it, there's a sense of alienation. And then the person with cancer, what I see, is often waiting for the other to reach out and touch them in a sexual way. And when the overture is not made, they feel rejected. And so then there's oftentimes this standstill, and it can be quite painful. And so what I really want to remind you is that it's so important to schedule regular time together that is beyond cancer and beyond cancer treatment, and is really about connecting in an intimate way. And when I say intimate, I'm not saying as a euphemism for sexual, but really as an intimate expression of your relationship, of your emotional connection, of being in love with each other in a loving, beautiful way where you can put all of the other concerns aside and really just drop in to be with each other. And when you have that scheduled on a regular, ongoing basis, that is a deposit right into the relationship. It's really making this beautiful investment into the relationship that will serve you both for much time to come. And that oftentimes it's easy to forget this, especially if you're feeling down or depressed, or you haven't had sex for a while, or you're not feeling emotionally connected. But the opportunity is to just make that commitment and show up for each other, even for as little as 20 or 30 minutes, to just drop in and forget the logistical pieces of life and just be with each other in a gentle and loving way. And with that, I want to say that it's really important to make that connection. What I often see is that there's a lot of anxiety that lives around sex and sexuality, deep shame, deep guilt, that on a cultural level and also on a very personal level, and then compounded with cancer-related symptoms or the treatment side effects. It just may feel insurmountable to connect spontaneously. Oftentimes I hear people say it's just not organic or it should happen naturally. And that is often not the case. And so one of the most important things is to be open to discuss and schedule some intimate time together. So it's kind of antithetical to the spontaneity and maybe erotic beginnings of relationships where people are driven more by hormones and that deep sense of falling in love, that as we come into long-term relationships, especially when they're challenged by health crises, that we actually need to schedule intimate time together. And that I can't say enough of that intentional time. We set so much intentional time for our lives. We're going to go to the gym. We're going to go to work. We're going to do these things that are going to help us feel better. But we don't often have that same intentionality in our relationships, and that it is so important. And that for the past few minutes, I've been emphasizing that intentionality in relationship with other. And truly, where it begins is in our relationship to ourselves. So oftentimes, this is a place where I mention masturbation. And I think a better term is really self-pleasure, because masturbation oftentimes is exclusively focused on genital connection with oneself. And really, it's about an opportunity to connect with oneself in a deep, intimate, loving way that is pleasurable. That oftentimes when people are giving themselves permission to come into self-pleasure, that actually can help activate their sexual connections with others. And when one is able to explore one's own body for their own pleasure, then they have a better sense of the tender areas or the places that don't feel as pleasurable as they did before, or maybe the expansion of their erogenous zones. And then they can inform their partner about what feels good. And that's really important, because oftentimes the partner wants to know, but they haven't explored it themselves. And if you're able to share that with your partner, that's a really valuable conversation that I know most partners are eager to hear. Most partners want to know how you're experiencing pleasure now, what they can do to help you amplify that pleasure now. So when you're ready to engage sexual activity with your partner, it is oftentimes a new experience. And some of the old ways that you may have experienced pleasure may not exist. And so it is this relearning process, which sometimes can feel daunting, but is also this liberated experience of openness, of you can have pleasure. Excuse me. You can have pleasure, and that it can just be different. And that oftentimes we may feel a little insecure, or we may feel shy about sharing what it is that pleases us. And oftentimes what I hear from partners is they really want to know, and that they prize the intimacy that can be created between the two of you. So physical closeness is important, even if it is not sexual, even if it is not genitally focused. So for some couples, what they've shared is just lying next to each other naked is an intimate experience, and one that keeps them connected, attuned, and bonded to each other. And that's really beautiful. So I encourage you to keep on speaking with your partner about the turn-ons in which you can engage that aren't necessarily sexual or focused on intercourse or focused on genital connection. For most people, especially as we get older, it is about the intimacy that you're able to share with another. And so one of the things that I wanted to say about sexual connection is that it's important to make it more comfortable. That is one of the things that is critical when you're feeling weak or you're feeling pain, whether it's from cancer treatment, from getting older, or just from experiences of life. So I think the novelty of trying new positions is important, and that oftentimes it's spurred by feelings of discomfort, and that the novelty of sexual positions that are new is great, because novelty releases endorphins and actually creates more sexual connection. So what I'd like to encourage you to do is to talk with your partner about different ways that you can enjoy sex, and that this conversation is best had away from your sexual activity. Oftentimes what I see is that people are connecting the conversation to the sexual activity, so their timing is off. So what I want you to do is to consider having this conversation prior to sexual activity, or disconnected from sexual activity. So maybe you're having a date where you're talking about sex, or maybe you're speaking about it after dinner, that it is not connected to the sexual act. That oftentimes there's a vulnerability that happens during and after the sexual act that's not conducive for talking. A lot of us just don't have fluency in speaking about sex. We often don't have the words or the vocabulary, and we sometimes don't have the confidence to speak about sex openly. And so when suggestions are made, it can often feel like criticism. So in order to avoid that, I encourage people to have these conversations with your partner at a different time, and really encourage your partner to be open about the exploration, that it can be exciting. So when you're resuming sex after cancer or cancer treatment, what I find, especially if there's been erectile difficulties, is that a man superior or a man on top who's just undergone the cancer treatment is usually best. Gravity helps, and that oftentimes men are able to keep their erection better in those positions. Side positions may be helpful, so there's not so much weight bearing, and that pillows can really be your friends. And I encourage people to be comfortable. There are so many props out there, so many tools available to help with positioning, and that oftentimes that is really important. And understanding that there's no one position that's right for everyone, and that you and your partner can figure out with fun what's best for you. And one of the biggest characteristics of success can be a sense of humor, and that messiness, awkwardness can sometimes be a part of this process. And the more that you're able to laugh and have humor and have a lightness, that there's an opportunity for more connection, and that it doesn't need to be heavy. It doesn't need to be so serious. It doesn't need to have so much gravity. That the more that we're able to infuse it with laughter and humor, the more that we can have fun with it. And that the mind is the most important sex organ, truly. It is not our genitals, but it is how we approach things. Can we approach it with lightness? Can we approach it with love? Can we approach sex with a sense of humor? And I really want to encourage you to do so. That in the beginning, when we're learning things anew, we are often awkward. We don't get it perfectly the first time. If you think about a baby getting up to walk, it bangs into things, it falls down, it rolls over. It doesn't just get up and walk with poise and grace the first time. It takes thousands of times to get up and walk. And that this opportunity to be sexual again with a loved one is really similar, that we get to learn again anew with grace and ease and lots of humor. So I want to encourage you to remember that. And that brings me to the psychological effects of cancer treatment on erections specifically. That the psychological impact is really important. So thus far, I've focused on the physical impacts and also the relational impacts, and now focusing more on the psychological effects. And when a man is not able to have an erection, they often feel very discouraged. They report that they feel disappointment, fear. I would say fear, maybe even unworthiness of their masculinity, that they may feel distress, and that this is all related to an inability to have an erection or to have a firm erection. And that oftentimes what they report is that they feel like something's missing and that it's something important that is missing from their life. And in some way, they feel emasculated. Okay, so men report a general unhappiness with life and also depressive symptoms when they have problems with erections. And I've seen this again and again, regardless of whether they're struggling with cancer or cancer treatment, but men who are having erectile difficulties often have depressive symptoms. And what I want to say is that these feelings are a common coping experience when having erectile difficulties. And that when a man is able to find effective treatment to help with their erections so they can have them and maintain them, they begin to feel better. And when these feelings are severe or persist, that it's important to get the support of a mental health professional. What I see is that worries about self-image and performance create a lot of anxiety, and then those can contribute to erectile difficulties. So instead of letting go and feeling excited and riding on the waves of one's sexual desire, a man may focus on his inability to function or his inability to have an erection, and then the fear of failure makes it happen. So the psychological component of erectile difficulties is one in which I focus a lot of my time in my practice. And a man may blame his erectile difficulties on his medical condition, even though if he were by himself or if he were able to relax, he could have an erection. So it's important to discern what is causing the erectile difficulties. Sometimes there is a biological basis for it, and sometimes it is actually psychological. And so I guess a thorough exam would be conducted to see if there was a biological basis. And oftentimes there's a psychological component that then can increase the erectile difficulties. And so I meant to mention this earlier, but I didn't. The types of sexual problems for men after cancer can include the erectile dysfunction, which I discussed earlier. It also can impact the sex drive, so meaning that you have a loss of interest in sex, or what's often said is low libido. Another effect of cancer or cancer treatment can be a shortened or curved penis. And this happens because the scar tissue has solidified after surgery, or there could be damage to the nerves or the blood vessels or both. And then a man could have Peyronie's disease. There can be a change in orgasm, as I mentioned earlier. There can be a change in ejaculation, also mentioned earlier. Or a man can have a retrograde ejaculation, which is essentially a backward ejaculation, where the semen travels up the urethra into the bladder instead of down the urethra out the penis. And then the semen comes out in your urine because it's been absorbed into the bladder. And this essentially doesn't harm you, but it is, I would say, an effective treatment sometimes. Other physical problems are fatigue, pain, nausea, shortness of breath, which can also impact your ability to enjoy sex and can cause aversion to sex. Another, I would say, effect of treatment, and this is a big one for both men and women, is body image problems, which comes back to the psychological component, is that you may have lost or gained weight, you may have lost muscle or gained breast tissue, which can be really uncomfortable for men. You may have an ostomy bag on your belly, or you may have scars or skin change. Any of these can make one feel self-conscious. And when we feel self-conscious and we don't feel comfortable or relaxed in ourselves, oftentimes we're less interested in sex. And that is, again, true for men and women. Of course, oftentimes I see it more in women, but men do have these experiences, particularly with cancer treatment. And then there's the changes of mood, depression, and anxiety that can happen and occur after cancer treatment, which can also impact one's desire. It can also cause erectile problems, as I spoke to a few minutes ago, and that's very real, that depression and anxiety can cause erectile difficulties. And so I wanted to, I see that I have a question here. I want to just check that out. So the options discussed after surgery, are those similar for after prostate radiation treatment? Thank you for your question. And I'm not sure what options you were talking about. I think the beds are an option after prostate radiation treatment in terms of the Viagra Cialis. I'm thinking that's what you're asking, but if I didn't get that right, please let me know. And then I know that some men are not in a relationship and that they're dating, and that they may have some concerns about how then to date after cancer, and that's a great thing to begin to explore, is that how then can you improve your social life, be connected with others intimately, and be vulnerable, and not necessarily have a significant other. And so dating concerns, I think for men, are one of the big ones, is when to reveal that they've had cancer or they're experiencing cancer treatment right now. And that what I encourage people to do is to explore what feels good for them. Because once you've said that you've had cancer, or that you're currently undergoing cancer treatment, that you can't take it back. And so it's good to consider what it is that you feel comfortable sharing. Maybe you're going out on a first date with somebody, you don't know them very well, and you don't necessarily want to be that vulnerable or intimate, and that's okay. Or maybe you've gone out on a few dates with somebody and you want to reveal a little bit more about what's going on with you, and then you can share a little bit more. But I think the most important thing is to remember that once you've shared it, you can't unshare it. So to really discern what you feel comfortable with, and that there are no right and wrong rules for when you share with someone, that you've had cancer or that you're undergoing cancer treatment. And now I want to come back to, for those of you who have partners, about communication and intimacy and vulnerability and sharing. As I mentioned earlier about the dynamic with a caregiver, when the caregiver has helped support the person with cancer, there's often that disconnect on how then to connect with them sexually, and how there's that chasm between the two with no one really having their needs met, and then how then to have those needs met in a respectful and loving way. And so just thinking back on some of the conversations that I've had with people who have been in long-term relationships and what worked well for them. And so one thing that I wanted to share, in addition to scheduling regular time for intimacy, that these couples prioritized their relationship and took some time away. So not only having regularly weekly scheduled times to connect, but also having regular trips where they were connecting with each other outside of their regular lives. And so oftentimes in the midst of cancer treatment, it's hard to imagine going away, and that there's an imperative that one stays in close range to their providers and caregivers. And that with consultation of your care team, if you can have some time to actually step out of your regular mundane life, that there is an opportunity to connect and drop in for more intimacy. Even if it's going to a friend's home just a couple of miles away and letting them know that you just want to stay in their guest room for the weekend. That coming back again to the novelty that this can create for more intimacy, and that sometimes it's so important to step out of one's regular mundane life to drop in with each other in a much more intimate and vulnerable way. And oftentimes, the aspect of vulnerability and sharing can be overwhelming. And the opportunity for more emotional intimacy is through vulnerability and really sharing what your concerns are, how this experience has impacted you, and that the words may be difficult to access. And again, oftentimes we just don't have the words around sex and sexuality to talk about our most intimate feelings and what it is that we desire. And the more that you're able to understand what it is that you desire and how to convey that to your partner, the more that you're able to have that and share that experience with your partner. And so, for example, I just want to share a story of a patient who had colon cancer and was unable to have penile vaginal intercourse with their partner, and that they had no direction from their care team about how to proceed. And a year after the initial surgery, they'd still not been sexual with each other because of the shame that they felt and because of the lack of information about how to be sexual with each other. And so they avoided it because they felt like they should know better, and yet there was no guidance for them. And at some point, they did try to be sexual with each other, and all they could say was that it was a disaster and that more shame ensued, and that they loved each other deeply and had been in a long-term committed relationship for a couple of decades. And they felt like the desire for each other should be enough. And yet there was such an awkwardness when they were connecting with each other sexually in that moment, because it wasn't like it had been before. And that this idea of a new normal just seemed insurmountable. They didn't have any idea of how to connect with each other in a pleasurable way, because they were going from the old ways that they used to connect and the old erogenous zones and the old ways of getting off with each other. And they just weren't able to do that. And then after some time of working with me, they gave themselves some permission to explore different ways of being sexual with each other that were not so genitally focused, that they were able to cultivate different erogenous zones within their body, their neuroplasticity, and that they were able to connect in a deep and meaningful way because there was less pressure about achieving orgasm, but just allowing themselves to experience pleasure. And with this reframe, there was a lot more levity, there was a lot more humor, and there was a lot more curiosity, playfulness, and creativity in their connection. And so a year and a half after their disastrous connection, they went away for a wild, kinky weekend together, and they were able to explore pleasure that was new and meaningful for them. And I think that's really important, that we can experience pleasure no matter what our circumstances are, and that the opportunity there is for exploration and going beyond this linear progression of sex as stimulation, penetration, ejaculation. When we go beyond that, that we are able to experience more pleasure. And so part of this process of sex therapy, particularly after cancer and cancer treatment, is the dismantling of the myths that are perpetuated by ourselves, by culture, by our friends, by misinformation out there, by pornography, which is entertainment and not education, about how the body experiences pleasure. And that oftentimes, again, we're stuck in this linear progression when sex is actually vast. And it's this whole menu of how we can experience pleasure with ourselves and with another. And then it's often reduced to penile vaginal intercourse in heterosexual couples, or penetration in homosexual couples, and that it is more than that. And so the more that we give ourselves permission to expand beyond that, the more that we can experience pleasure in our lives. And so I really want to encourage you to explore what it is that you desire or that you imagine you might desire, and that that's really important to give yourself permission. Because when we stay in the box of what pleasure is and what sexual connection looks like, then we're limiting ourselves. And pleasure can really go beyond our wildest dreams if we allow it. So really want to encourage you to live into that to the best of your ability. And I'm just going to see if there are more questions here for me. And let's see. Okay. Okay, so I want to invite you to ask any more questions if you have questions. Any more comments? I appreciate you joining me today. And this is my contact information. My website is taragalliano.com. My other websites are bouldersextherapy.com, rediscoveringmybody.com. You can also reach me at my phone number, 303-544-1400, text or phone. And I'm happy to set up a consultation with you to learn more how I can help support you in your desire and your sexual connection and sexual pleasure. So feel free to reach out. I would love to help support you. So thank you so much for joining me today. And I look forward to speaking with each of you. Be well.